Brown gold by the name heroine. Brown gold by the name heroine is a powerful and controversial substance that has captured the attention of many. The history of this drug is long and complicated, beginning with its first known use in the 19th century and continuing today in various forms. Despite the controversy surrounding it, many people have found its effects to be beneficial and have used it for medical and recreational purposes. In this video, we will explore the history, benefits, and risks of brown gold by the name heroine. Before moving forward, if you are new to our channel, don't forget to like and subscribe our channel for future interesting videos. What is heroine? Brown gold by the name heroine is a powerful and highly addictive drug derived from opium. It is also known as diamorphine and diacetylmorphine. Heroin is typically sold as a white or brown powder or as a sticky, black substance known as black tar heroin. It is usually injected into the veins, but it can also be smoked, snorted, or sniffed. Heroin is a central nervous system depressant, meaning it slows down brain and body function. It produces a rush of euphoria and relaxation, followed by a sense of warmth, heaviness, and drowsiness. These effects are what make heroin so addictive and dangerous. Heroin use has been around for centuries, but it became more widespread in the late 19th and early 20th centuries. It was used as a pain reliever and cough suppressant, and was even given to soldiers during World War I. However, it quickly became apparent that heroin was highly addictive, and it was outlawed in many countries. The history of heroin use. Brown gold by the name heroine has been used for centuries. Its origins can be traced back to ancient civilizations, where it was used for medicinal purposes and as a pain reliever. However, it wasn't until the late 1800s that the drug was synthesized from opium and marketed as a non-addictive alternative to morphine. It was initially used as a cough suppressant and pain reliever, and its popularity quickly grew. In the early 1900s, heroin was being used recreationally and as a treatment for addiction to other drugs, such as morphine and alcohol. It was widely available and considered fashionable, especially among artists and musicians. Heroin addiction and its effects. Brown gold by the name heroine may have an allure that draws in many users, but it comes with dangerous consequences. Heroin is an extremely addictive substance that can quickly lead to addiction. Research has shown that nearly a quarter of individuals who try heroin end up developing an addiction to it. The effects of heroin addiction can be devastating to both the individual using the drug and their loved ones. As an opioid drug, heroin works by attaching to receptors in the brain that are responsible for pleasure and pain relief. With regular use, the brain becomes dependent on the drug to function normally, leading to physical and psychological dependence. Those struggling with heroin addiction often experience a range of negative effects, including mood swings, anxiety, depression, and social isolation. Heroin use can also damage the body, leading to infections, abscesses, and other health issues. Over time, the risk of overdose also increases, which can result in coma, brain damage, or even death. How heroin affects the brain and body. Brown gold by the name heroine can have devastating effects on the brain and body. When heroin enters the brain, it quickly converts into morphine and binds to opioid receptors. This results in feelings of euphoria and pain relief. However, with repeated use, the brain becomes dependent on heroin to produce these pleasurable sensations, leading to addiction. Heroin use also disrupts the natural production of endorphins, which are responsible for regulating pain, stress, and emotions. The physical effects of heroin use are numerous and severe. Injecting heroin can lead to collapsed veins, infections, and abscesses. Long-term use can cause damage to the liver, kidneys, and heart, as well as respiratory failure and an increased risk of contracting infectious diseases like HIV and hepatitis. Common methods of heroin use. Brown gold by the name heroin is commonly used in various ways. The drug is usually injected, smoked, or snorted. The injection is the most common method of use because it delivers the drug into the bloodstream quickly, producing an almost instant high. The injection also results in the most potent effect, making it a favorite method of use among hardcore users. However, injecting heroin carries the highest risk of overdose, infections, and other health problems. Smoking heroin involves heating the drug on a foil or spoon and then inhaling the vapors through a straw or pipe. Smoking produces a milder high, but it is less risky than injecting, as it is more difficult to overdose and contract infections. Snorting heroin involves inhaling the powdered form of the drug through the nose. Snorting delivers the drug slower than injection or smoking, resulting in a less intense high, but it is still risky. Snorting can cause severe damage to the nasal tissues and may result in lung problems. Some users also mix heroin with other drugs, such as cocaine, which is known as speedballing. This practice can result in even more severe health problems and has caused many overdoses and deaths. Overdose and other risks associated with heroin use. Unfortunately, brown gold by the name heroin comes with a plethora of risks that are not to be taken lightly. Heroin overdose, in particular, is a major concern among users and their loved ones. An overdose occurs when the body is unable to handle the amount of heroin that has been ingested, and it can lead to serious medical complications and death. The risk of overdose is increased when heroin is combined with other drugs or alcohol. Aside from the risk of overdose, there are numerous other dangers associated with heroin use. Regular heroin use can lead to a weakened immune system, making users more susceptible to infections and illnesses. Heroin addiction can also cause serious damage to vital organs, such as the heart, liver, and kidneys, which can lead to long-term health problems and even death. Heroin use also increases the risk of developing mental health problems, such as depression and anxiety. This is because heroin affects the chemical balance in the brain, leading to changes in mood and behavior. The risk of developing mental health problems is further compounded by the fact that many heroin users have underlying mental health issues that go untreated. Treatment options for heroin addiction. The sad truth about brown gold by the name heroin is that it's an incredibly addictive substance that can quickly take control of someone's life. However, the good news is that there are effective treatment options available for heroin addiction. The first step in treating heroin addiction is often detoxification, which involves ridding the body of the drug. This process can be difficult and painful, so it's important to do it under the supervision of medical professionals. In some cases, medication-assisted treatment, MAT, may be used during detox to ease withdrawal symptoms. Once detox is complete, therapy and counseling are often used to help individuals understand the root causes of their addiction and develop coping mechanisms to avoid relapse. Behavioral therapies like cognitive behavioral therapy, CBT, and contingency management, CM, have shown promising results in helping individuals recover from heroin addiction. If you enjoyed from this video, don't forget to like and subscribe our channel for future interesting videos. Thanks for watching.